In this section of the Joints and Movement chapter, I want to discuss a couple of joints in particular and how they have some clinical relevance. I want to begin by discussing several aspects of the knee joint. There are several things that happen with the knees that are clinically relevant, especially as people start to age and there are problems that develop with their joints. The figures from the book that we're going to be looking at have quite a number of things labeled in them, and I actually only want to highlight a couple of things in each one. In this first one, I want to point out the cruciate ligaments. There's an anterior cruciate ligament and a posterior cruciate ligament. Those two are often referred to by their abbreviations, ACL and PCL. And most likely you've heard of at least one of them in regards to a torn ligament. The cruciate ligaments are named that because they cross over. The posterior cruciate ligament connects the lateral tibia to the medial femur, and the anterior cruciate ligament connects the medial tibia to the lateral femur. They are useful in that they keep the knee joint stable in lateral movements. The knee joint, though it seems to bend like a hinge joint, is actually a condyloid joint. There isn't any muscular control over lateral movements, but the condyloid joint structure allows for a little bit of movement from side to side, which helps to stabilize the knee, or I should say, helps the knee to withstand a little bit of lateral movement or trauma. The cruciate ligaments are there to stabilize that movement side to side. The anterior cruciate ligament keeps the knee from bending too far lateral to medial, and the posterior cruciate ligament keeps the knee from bending too far from medial to lateral. If force is applied laterally to the knee, such as in a sporting event, if one player clips into the knee of another player from the side, then excessive force applied to the knee is going to tear these ligaments. And so lateral trauma to the knee is going to cause a tear to the ACL, or anterior cruciate ligament, which is probably the more common of the two possible injuries that I'm talking about here. So most people have heard of ACL tears. Now in this picture they obviously point out another ligament that's torn, but I'm just keeping with the cruciate ligaments in this discussion. The next aspect of the knee joint to discuss with its clinical relevance is the meniscuses, or menisci, or menisci, however the plural is pronounced. There are two pads of fibrocartilage, the medial meniscus and the lateral meniscus, which are laying in between the distal head of the femur and the proximal head of the tibia, taking compression force as the weight of the body presses down on the knee joints. That fibrocartilage, if it gets damaged, will stop being able to do what it's supposed to do in helping to absorb some of the weight of the body on the knee joint. It's very common as people get older for the meniscus to break down, and that will cause the bones to press directly into each other, which can be very painful. There's research that's been done over the past maybe 10 years looking at ways to improve this. I was doing research at the University of Connecticut Health Center a while back, and I know that the sports injury people there were doing some very good work looking at replacing the fibrocartilage or possibly even growing new stuff or artificial stuff. I don't know where that is at this point, but it's been a very promising direction to help people with those sorts of problems with their joints. The last aspect of the knee joint that I want to discuss isn't really clinically important so much as an explanation of the anatomical description of the components of the joint. I've highlighted here a couple of important names, the tendon of the quadriceps muscle and the patellar ligament. Those two fibrous connective tissue structures are actually one thing. They're separated by the patella, but the patella is a sesamoid bone which really developed out of that tissue. Before the patella calcified there, the tendon of the quadriceps basically just went all the way to attach to the tibia, and then the patellar bone calcified out of that soft tissue as a sesamoid bone would do. However, the names that are given to structures are based on the adult structure. And so the tendon is the muscle to a bone, and that bone is the patella. And then the ligament is bone to bone, which is patella to tibia. But really, as far as the function of that muscle, the tendon and patellar ligament are one continuous piece of tissue, which is allowing the muscle to attach to a relatively fixed bone so that it can do its work. In describing the ball and socket joints of the hip and shoulder earlier, I mentioned that the shoulder has more range of movement because the socket part is more soft tissue than the acetabulum, which is all bone tissue at the hip. But I also want to mention at the shoulder something that's common at a lot of joints, and not just the shoulder, but those are called bursae. Bursa is a singular, bursae is plural. A bursa is something similar to an articular capsule. It's a little pocket or purse, which is really what bursa means, that's lined with something like a synovial membrane that secretes a fluid for lubrication. The difference between an articular capsule and a bursa, however, is that one is lubricating the actual joint, where one bone is moving relative to another. Bursae are where different aspects of a joint are moving relative to each other, and there needs to be a little bit of lubrication between them. Here we see two things, one that's called a bursa and then another that's called a tendon sheath, which is a very similar structure. The bursa that we see here, the subacromial bursa, is between the acromion of the scapula and the head of the humerus, with the tendon of the biceps running underneath it. And it allows for some lubrication as the head of the humerus moves underneath those two structures. And that tendon sheath wraps around the tendon of the biceps because that muscle isn't really involved in movement at that joint, but the tendon goes through the joint. So it needs its own surrounding lubricating structure, which is a tendon sheath, which is really just another type of bursa. Bursae are important clinically because they can develop an irritation similar to arthritis called bursitis, which is an accumulation of fluid at the bursa rather than at the articular capsule. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. The two menisci are the fibrocartilage components of the knee joint. There's a medial one and a lateral one. Of course, medial is the only one listed here.